to frame this, the context in which we're trying to consult with you, basically we've been in existence as the Agriculture for Nutrition and Health program across the CGIAR centers for 2 years. And we're planning for what we're doing in future. And we see one of the areas where we think that more research is required is in food safety. Okay? And part of that is what we assume is a growing concern. And also, I think as framed by Delia, we also see that the issues are a little bit different. We think there'll be important inputs from kind of commercial food safety systems that we already see, but we think that we'll also need to do some things differently. And so that's kind of how we're framing it. But I'm going to ask you I'm going to try and frame our discussion today to get your inputs around different assumptions we have, different priorities, and different ways of working that we need to look at. And we would really appreciate your input. This is just one step. You will get to know us, and we can continue this conversation as we move forward. So this year, as we look forward, we're trying to do two things. We're trying to evaluate the work we've done in the past, and we're trying to plan for the future. And so part of that evaluation is to look at the work that we've done. There's been very interesting work done in informal markets, particularly in milk, but also meat, and some you'll hear from different people. There's been quite an amount of work done on aflatoxins in a variety of centers, looking forward to how we can control that. And there's a lot of kind of economic and health risk questions with that in terms of moving it forward. And we see, we talked about the concern and who's concerned. If you go and do a public opinion poll in China, for example, you'll find that the public they have two major concerns. One is environmental air quality, and one is food safety. And it comes very much on their list of priorities and things they're very concerned about. Okay? We see this in other places in Asia. There's growing interest in Africa. So we see this as a concern, and it's really helpful moving forward. You talked about the fear factor, I guess, but it's really helpful moving forward that people can understand the risks and how to manage risks, because risks are always around us, and poor people actually face many more risks than many of the rest of us. So that's kind of framing the consultation and how we're planning to move forward, and we really appreciate your input. I want to lay out some of our basic assumptions moving forward, and feel free to challenge them and modify them. Okay? So the first one is, do you think that this growing concern that we're perceiving is actually true? And what are your experiences in terms of food safety concerns or demands? Who's concerned and why? Are there particular populations that we need to think about? So the one is around the concerns. The second one is around kind of knowledge gaps. Okay, so Delia laid out a number of different kind of research studies and evidence that some of which is counterintuitive, some of which looks differently than what we expected. So do we need more research, or do we have ready-made solutions that can just roll out? Where is the research needed? Where can we just act now? What are the types of actions that can take place? If we're going to act, how do we evaluate and see whether we're doing a good job or not? And what types of research? Okay? Is it just about technologies and their applications? Does it relate to policies? Does it relate to health risks? What kind of research? Is it operational research on how the system's working? So that's our kind of basic assumptions, that there is a growing concern and that there's a role for research in this, but please feel free to challenge. Now, we've set out in this consultation some initial priorities that we have. Okay? So one is the types of food chains that we're going to focus on. So one is on mycotoxins and staples. The second is around animal source foods. And the third is around vegetables and fruits. And you can imagine what the kind of food safety concerns might be in those. In terms of the types of markets, we're assuming that our role will be more, because we're looking at public goods and poverty alleviation, and really a focus on poor people, on informal and formalizing markets where poor people participate as producers, as market agents, as consumers. But we will want to take into account the broader context of emerging supermarkets, of what the private sector is doing, because obviously the public sector wants to leverage and fill in the gaps that are left behind by the more market-oriented solutions. So there has to be a coming together of that. I described already some of the questions about what types of research, and we'd like your inputs on that and your experiences. And what kinds of objectives do we have? We know in all of these things there's going to be trade-offs between kind of economic growth and health issues sometimes. What are those trade-offs? How do we look at those? So those are a bit of the questions of what we should work on. We also want to get your input into how we should work and who we should work with. Okay? Who are the key research partners that we need to work with, and how do we engage them? And some of that might be, it may be that we don't focus so much on technology development, but on adapting technology with other partners. So what does that look like? How do we build the long-term research capabilities in the countries who have to manage these things and move that forward? And then how do we, in the partnership side, who do we need to make stronger links with? Who in the value chain, among the value chain actors in the private sector? How in kind of country-based strategies? How do we put those together? How do we share experiences across countries? And I just wanted to kind of give you a background of who some of the partners might be, okay? Because if you think of food safety, it's a kind of complex web of the kind of overall enabling. So what are the kind of regulations? What are the kinds of investments in food safety? Who does that? It's also a question of implementing certain programs sometimes when there's specific needs, often done by government, but sometimes by others. It's in engaging all the value chain actors, and Delia described many of the ones involved in kind of milk and meat, but there are obviously different ones in different types of food systems. For example, in the vegetables and fruits, who are the key actors we need to engage with? And then who are the kind of research partners? How do we get this kind of evidence thinking moving forward? And who needs to be engaged in that? So that gives you a bit of a framing of the kinds of questions that we're thinking about in planning forward. And we're really looking for your input. We'll see how far we can go in the first hour and a half, but, and then we'll get other inputs later. So thank you.
Thank you, John.